HRV is heart rate variability, which if you think about it, it's your heart rate. Okay, so your RR intervals, if you're looking at it on an EKG or like a Holter monitor or something, and then it's variability. So, you know, people's heart rate changes over time. And when that change occurs, you can essentially measure the difference in that RR interval. And you can look at it in many different ways. You can look at standard deviation. You can look at like root mean square differences. You can actually go way, like there's a ton of literature. There's a ton of different ways. You look at low frequency, high frequency, you look at the ratio. Essentially what it is in a nutshell though, is it's the, like the beat to beat variation in your RR intervals. And so that heart rate variability is essentially how your heart rate is changing to an external stimuli, or internal. You know, your kind of your parasympathetic and sympathetic nervous system, which is obviously under regulation of, you know, hormonal changes, stress, emotions, but also, you know, like external stimuli. Like if a tiger walked into the room right now, like probably my heart rate would jump up and I would go run and we'd end this Zoom call. You know, you have activation of the sympathetic nervous system. So your heart is going to, your body's going to tell you to increase your heart rate, you know, a fight or flight response. And the rate that heart rate changes, how responsive it is to that external stimuli is essentially what heart rate variability is captured. So if you are, you know, well rested and well recovered and things like that, and your heart rate is sitting there, say it's like, you know, your resting heart rate is 50 or 60 beats per minute, and like boom, it'll jump up very quickly. Versus if, you know, you just came off of a 24-hour shift, which I did yesterday, and you're just kind of tired or whatever, you're really stressed out, your heart rate response is going to lag. And so your variability is going to be lower because it's basically going to be similar, you know, variation in terms of like how many milliseconds are between your heartbeats. And so that what that heart variability is like a balance of your autonomic tone, your parasympathetic versus your sympathetic nervous system. And what that readout essentially means is like how recovered you are or how ready you are to take on additional strain. And I think that strain can be both a physical stress, you know, training in the gym or, you know, obviously going on a run or whatever, or mental and emotional stress. You know, you go in and we all have stressful lives and, you know, regardless if you're in medicine or not, you know, things are super stressful. Like look at COVID, everybody's been under the gun there. And so, you know, you're kind of looking at your heart rate variability is like something that you want to optimize over time, both on it from in the acute setting, like day to day, but also long-term trends. And so you can look at the acute setting heart rate variability is like, okay, it's what I did the day before, the couple days before, sensitive to like you know, you eat a late meal, you're going to have much more parasympathetic stimulation overnight. Versus like, you know, you're just really doing well with like eating clean, doing a lot of training, your heart rate variability will generally be high. But there's a lot of things that can change it. You know, you overtrain a bunch, like it'll eventually be lower, but the overall trajectory over time is going to be higher. So what I'm getting at is you can actually use that as a marker of overall improvements in fitness. And if you look at it, I actually recently wrote about this and used some of my own data as an example. You can look at HRV trends on a month-to-month basis of averages and see if you're basically like improving your fitness, if you're staying the same, or if you're kind of like slacking a little bit. And, you know, you're like, oh, maybe I should allocate more time to diet and exercise, you know, if you're interested. Or you can just be like, oh, I'm good, I'm glad I have the data and I know what I'm doing, but you know, right now I'm really busy or I'm tied up with work and I can't allocate any more time. So it really allows you to guide your lifestyle decisions, guide your, you know, kind of productivity from a work standpoint, and it kind of gives you that readout of like, this is what I've done and this is what I can do with it. And so I think that it's an extremely powerful metric, and it's why it's the largest contributor to the recovery score that WHOOP uses.